Hi, this is Dr. Helen Pensanti. Are you confused about the difference between natural and synthetic hormones for women? A lot of women are, especially since their very own private medical doctor hasn't got a clue about what natural hormones are all about or how to prescribe them. I advocate using natural hormones for both PMS and menopause because there are virtually no side effects with natural hormones. In 1993, I was practicing medicine in Santa Ana, California. As a traditional doctor, I had about 7,000 patients and saw between 60 and 70 patients a day. I wrote many prescriptions for synthetic hormones. But one of the things that alarmed me was the fact that my patients would come back with, first of all, a lot of weight gain from synthetic hormones. They could put on anywhere between 40 and 50 pounds within 6 months. I was very alarmed by this. A lot of the other side effects were swelling, not sleeping, not feeling well, breast tenderness, agitation. My patients were a mess. After reading some of the journals that doctors are required to read, I began noticing that the statistics for cancer were on the rise. For instance, in one study in 1995, a nurse's study, it stated that women who use synthetic hormones had a 46% increased risk of getting breast cancer or uterine cancer. This was unacceptable to me. I was not going to write a prescription and tell my patient, oh, by the way, you have a 46% risk of getting cancer. It was at that time I began searching for a natural way to treat symptoms of hot flashes, night sweats, vaginal dryness, insomnia, anxiety, depression, and many of the other things that go with menopause, as well as the irritability, mood swings, depression, and all the things that go with PMS. I found natural progesterone first. I read a book by Dr. John R. Lee, and I call him the father of natural hormones. After reading that book, it totally changed my life. I never again wrote a prescription for synthetic hormones. In fact, one doctor that I know coined this phrase, "It's a sin to take synthetics," and I believe that. One of the wonderful things that I've learned in my search about natural progesterone is that it actually protects women from breast cancer, uterine cancer, and ovarian cancer. There was a study out of Johns Hopkins University in Baltimore, Maryland, that said that women who had high progesterone levels in their blood actually had a decreased incidence of breast cancer, uterine cancer, and ovarian cancer, as well as a decreased incidence of all kinds of cancer. So I am a very strong advocate of using natural progesterone and natural estrogen for menopause and PMS. Join me now as we go to a live interview with Dr. John R. Lee, the father of natural hormones. Dr. Lee, what a pleasure.
Thank you very much.
I don't know whether to laugh or cry. You are my hero. I mean, you are everything. It all started, ladies and gentlemen, if I could find.
Way back when.
Way back when, in 1990, for me, 1993, someone handed me this book called Natural Progesterone, and it changed my life. I feel like I'm giving a testimony or something, start crying, but it's true. I was a traditional doctor who did office gynecology. I wrote so many prescriptions for synthetic hormones, I can't even tell you in a day. Well, I can tell you this. The pharmaceutical companies, their rep came and took us to lunch every week because I wrote so many prescriptions and built up their company. They were always whining and dining us to thank us. And I read this book, and I never wrote another prescription for synthetic hormones. And as one of my latest doctors gave me this little thing, it's a sin to take synthetics.
All right.
But I have you here now. We haven't seen you. My audience hasn't seen you for 5-6 years.
Right.
Been probably since '94. And you have gotten so famous.
Oh, no.
Yes. But let me tell them about you. Wait a minute. First of all, let's tell you about his history. Dr. Lee is a graduate of Harvard, and then he went on to the University of Minnesota, and then started practicing in Mill Valley, and had a wonderful little life, and then all of a sudden retired from practice, and the Lord, I guess, just opened up natural hormones to you. Tell the story, the early story of how you were studying you were editing, weren't you?
Yes. Well, it goes back to I think it was 1978. And I heard about natural progesterone was available and how wonderful it was. And I write about it in the book. And I had a group of patients with severe osteoporosis who had previously had breast cancer, uterus cancer, and so on, and they could not use estrogen. And I was the same type practice you were in. I was used to writing prescriptions for estrogen all the time because we were taught that estrogen was good for the bones, made the bones stronger. It was the treatment for osteoporosis. But these people couldn't take it, and I thought, well, it's safe to give the progesterone because women during pregnancy make a ton of progesterone, 400 milligrams a day. So I was giving them 10 or 15 milligrams a day as a cream and following their bone mineral density tests, and to my surprise, their bones got better. It took 2 or 3 years, but their bones got better and better. But then more surprises came. It compounded. Each of the individual women would say, and by the way, my fibrocystic breasts are now back to normal breasts. Other people would say, I used to have to take a lot of thyroid medication, and now I don't. Other people would say, I was overweight and I couldn't lose weight no matter how much I exercised. Now I'm on progesterone and I can do that. And others would say their migraines went away. And that's what got me starting to look at the references. I would go to Marin General Hospital, which is our local hospital, and the local librarian and I would form a team, and I would bring in these examples of what the patients were telling me, and she would go to the University of California library and find, through their computers, if there was research on that, and she would bring it back to me, and we found all this research was there. This has already all been done, and nobody's been telling doctors. But
no one.
So the more I learned about it, the more I began telling my colleagues, and the more I was trying to put something together to teach my patients.
First book.
That's right. And so as I was approaching my 60th birthday and had been in practice for 34 years, I decided, well, I don't know how it was with you, but when I was in practice, I just didn't have the time or the energy to. I find that writing and the research and doing all the references a full-time job.
Absolutely. Yeah.
So I had to make a decision, and I decided that this was important. And this is what I wanted to do. I wanted to tell people about the natural hormone.
And we thank you, Dr. Lee. Then you wrote a book called What Your Doctor May Not Tell You. Now this, how many copies did this sell?
Well, it's over 600,000 copies have been sold in the last 2.5 years. And it's amazing. This book was really an explanation of the first book. The first book was more biochemistry, less explanation.
And written for doctors,
and I was writing it for my colleagues to say, look, this is the way the biosynthetic pathways work. Why aren't we using the real hormone instead of something that's not correct? And this was our attempt to try to explain it. But the emphasis was still on all the changes that occur around menopause. But now, since we have so many women now seeing doctors and getting bone mineral density tests and getting their saliva tests to find out what their hormones really are, we find that by the time people are 35 years old in Canada and the United States, half of the women are already deficient in progesterone. Their ovaries are not producing the progesterone that their grandmother ovary did.
And why?
Well, we think that there's been a variety of reasons. One is stress, because cortisol can damage the function of progesterone by competing for progesterone receptors. Cortisol also changes the way your limbic brain controls the functioning of your own ovaries. If you put a college girl under a lot of stress, she might well miss a couple periods because the computers are not telling her. Well, she might miss another period if she gets pregnant too, but you can rule that out. And so stress is one. And then another thing is bad diet. People are eating a highly processed diet. And it turns out that the inner workings of the body require all these different metabolic factors, all the essential fatty acids and the complex carbohydrates and the right proteins and not the exhausted food. I think of it as exhausted food, like the inner starch of grain rather than the whole grain, or eating an extract called safflower oil instead of eating some safflower beans or seeds themselves. So I think that, but the big reason is that in the last 50 years, the ovaries of women that start, the ovaries in women are put into place in the ovary. Let me do it differently. The follicles, right. The follicles that make the eggs and that make the progesterone, they are put into place in the ovaries when you are only 18 to 20 days old as an embryo. Isn't that
6
amazing?
6 million, yes.
Yes,
yeah.
Right. They're all there. They're going to be ready for later on. However, in the last 50 years, the moms have been exposed to what we call xenobiotics. These are they were first called xenoestrogens because they do have an estrogenic-like effect. They're very potent, and the word xeno, X-E-N-O, means foreign. They're foreign to the body, and these are all the pesticides and the herbicides and the poisons that are in the environment. They're the things that are plasticizers that are put in the mustard in the salad dressing that you have, and it's in the plastics that we use. And we don't get enough of them as an adult that we can see obvious damage to the adult. But if the adult is a pregnant mother-to-be and the embryo is 18 to 20 days old, that ovary is damaged by those xenoestrogens. And if it's a male embryo, then the testes are damaged. The Sertoli cells in the testes are affected so that when the men grow up, when they're 40 years old, they're only making half the sperm that their fathers made.
Oh, my goodness.
Isn't that amazing? And now we have the women not being able to make enough progesterone. And we have 25, 28, 30-year-old women maybe have one baby, and now they find they can't carry another baby because they can't make enough progesterone. Progesterone is essential for the development of the embryo, the survival of the embryo. In fact, that's how it got its name. It's the progestation hormone. And gestation is the time from getting pregnant to the time the baby's born. From conception until birth is gestation time. And the hormone that allows that to happen, that is necessary for that to happen, is the progestation hormone, progesterone. Funny thing is that these synthetic progestins that are used in birth control pills, or in Provera even, which is the most common synthetic progestin, it's not real progesterone, used in women in hormone replacement therapy. So the progestins are not the same as progesterone. If you give that woman progesterone, then you help ensure that the baby is going to grow. But if you give the synthetic, you will make sure that it doesn't grow.
That was the best explanation I have ever heard of
the
it.
Conventional
That's wonderful.
Doctor, the conventional doctor thinks that these synthetics are the same as progesterone.
Yes.
I don't know how that arrived.
I think that's what they were taught in medical school.
It's clever advertising, apparently.
Well, I think once you're taught something from day one, it's hard to teach an old dog new tricks.
Right, because when you're in medical school, you're soaking up as much as you can, and you have to believe everything you get. You don't have time to question things. Yeah. You just automatically.
No, you can't.
You're just soaking up.
Well, you hope that people who are teaching you are integrous enough and honest enough to have done their homework. If they're going to bother teaching you something, that they're not just passing down information without questioning it themselves.
Right. Well, many things start as a hypothesis, and then it seems to fit for a while, and then it becomes like a gold standard, and it gets reprinted in books. And the original work never said, it's like the cholesterol theory. Oh. The original work by Ansel Keys did not say that eating cholesterol will give you a heart attack. He says that in the countries we studied, those people in that country that had much higher levels of cholesterol than the typical person in that country were the ones who got the heart attack. He did not say that eating cholesterol made that. There's nothing wrong with eating the fats. Mm-hmm. Actually, we make most of our cholesterol by eating sugars and the highly refined starches.
Well, and now they're saying that if your cholesterol's too low, you'll stroke out.
That's
so
right.
It's a mess. It really is a mess. Yeah. But let us talk about menopause today. You are, like I had introduced you, you are the father of natural hormones, and you will go down in history as you have your place in history.
Well, I want people to know a couple things. One is, I'm putting down my observations of 20 years of seeing this happen, and I learned it all from my patients, all right? And they got me to then look to the literature, and I found that in the scientific literature, it's all well established. I'm not the pioneer in this. I'm the pioneer in telling everybody about it.
Well,
but
you
the other
ended
thing,
up being the pioneer.
Yeah, but the other thing I want people to know is I don't think progesterone is the answer to everybody's problems.
No.
It's an important factor that has been overlooked by conventional medicine.
Right.
And when people start recognizing that and putting it in, helping out with people who need it, then they see the benefits. But,
all right. You happen to have said that, now the first thing that happens, the first question I get from women is, well, I go to my doctor and he doesn't believe in it. That's probably our first step. And you've told me you have just done a research.
But I know. What I tell them, when they call me with that too, you know, I get 20 or 30 phone calls a day.
Don't give out your phone number.
No, I know. And my brain turns to mush by 5 o'clock in the afternoon because things I started in the morning trying to do, I never get done. But they call up and they say, I went to the doctor and he says, well, I don't believe that, or I don't think he's proved it, or something like that, or we think otherwise. And I always tell the caller, I say, go back to the doctor and ask for the references that he has for his. And of course, he doesn't have. He just has something that he remembers from medical school, or somebody in the hospital corridor told him something. But what I've been doing lately is kind of interesting. In September, in all the conventional medical journals, they declared a battle is on. They have realized that a recent Harvard study last year showed that when people go to the doctor, 40% of the time now they're going to alternative doctors. Isn't that amazing? So conventional medicine has become alerted to the fact that there's a competition out there, that people can choose alternative doctors. So rather than try to look at themselves and say, I wonder what we're doing wrong that is driving the patients to the alternative doctor, they're saying, but conventional medicine is the only one that uses evidence, that is based on evidence, and that alternative medicine is based on folk tales and stories and crackpot biochemistry and anecdotes and so on, as if there weren't a great middle ground where doctors have to treat very complex problems. They have a smoker who has breast cancer. They have a diabetic who also has heart trouble. Everything is much more complex than any of these double-blind randomized studies ever arrive at. So I'm not blaming the doctor. He's got a big problem. But what they've chosen as their attack line, they draw the line in the sand, they've said, we are the ones who, we only do what we do for the patients when it's based on solid evidence. And by that they mean double-blind, placebo-controlled, randomized studies. Well, since September, I've been keeping an eye out in the medical journals for good studies about hormone things. And I've gathered 3 pages of references here to show that the things that conventional medicine is trying to tell their patients have now been disproved by these very same studies. For instance, conventional medicine believes that estrogen falls to 0 after menopause. This is not true. Women, 2/3 of the women who are 65 to 80 years of age, in a recent study in the New England Journal of Medicine, found that they make plenty of estrogen after menopause. It's just that it's not used very well because the body is lacking progesterone. Isn't that something? Or that their liver is making too much of a sex hormone-binding globulin and it's not being released. But it's all there. There's just something else is not making it work. And here the work is all done. Let me choose another one. Conventional medicine believes that Fosamax is a good treatment for osteoporosis. Do you know that until last year, there was never a face-to-face or a drug-to-drug test comparing it to the old-fashioned estrogen with a little progestin with it and diet and so on? And now there has been one completed. Involved women in Europe and UK and Canada and some in the United States, and they compared them with the old-fashioned with a little Premarin and a little progestin if they wanted, and then 2 different levels of Fosamax and a placebo. And it went on for well over 2 years, and they found that the Fosamax was very close to placebo. Did very little for the bone, was loaded with potential side effects.
Oh, they get esophagitis
and gastritis. The bisphosphonates are actually known to the women in your audience That's the ingredient that they put in the bathtub powder because it will dissolve the skin cells that have made the gray line on the bathtub.
Oh, my goodness.
Bisphosphonates will dissolve skin cells. So the Fosamax is a bisphosphonate.
Okay, so for you women who have written to me and said, what do you think of Fosamax? You got your answer. Don't think very much of it.
It didn't do very well, and it was loaded with side effects. It's amazing. And it was funded by the people who make the Fosamax. Can you imagine this study?
Well, of
no, instead of saying that, well, it looks like old-fashioned Premarin is better than this Fosamax, they said, Fosamax is almost as good as Premarin. They tried to make the best out of it, but it wasn't close.
I believe we have a duty to, the Bible says that my people perish because of lack of knowledge. And I think this would be something, if anybody is thinking about going on natural hormones and you're having this controversy with your doctor, and he needs to be educated. So this would be something that you could take into your doctor, hand to him, and said, before you make your decision about natural hormones, could you just read this? I think it would be a blessing.
Well, this is what we want. I want the doctors to read the articles that exist.
See this.
Because, there's so many of them are based on 10 or 12 people.
Right.
It's too small a number to know, because we know in practice that people differ.
Absolutely.
And just by chance, you can get one person who does well on digitalis, another one who doesn't.
Yes,
it doesn't mean anything. So we do appreciate it when good studies are done.
Yes.
But the fact is, there aren't that many good studies.
Yeah, and you've now listed them.
So I've listed the ones in the last year that totally contradict conventional medicine's position on lots of things. They were taught these things, but it turns out they're not true.
Good. All right, let's get to the menopausal lady in our audience. And let's say she's coming to you. She's 51 years old. She hasn't had a period in a while. And she's starting to get a little hot, having a problem with having intercourse with her husband. It's a little dry, but not too bad. And she doesn't know, should I even start hormones? Do I even need it? Can I bite the bullet and get through it?
Sure.
What would you suggest?
Well, first thing, I say, now, if you're sure you're not pregnant and you've skipped a couple of months here, I would say that you're approaching menopause. However, you're still making estrogen, because you made it 2 or 3 months ago. You probably have a couple more periods. You're still making estrogen. What you are missing, and what you've been missing for 10 years probably, is progesterone. And when you're missing progesterone for a long period of time, what happens is the body tries to protect you from estrogen dominance by tuning down estrogen sensitivity at the receptor sites. And this is a known fact now, that one of the functions of progesterone is to restore normal sensitivity to the estrogen. So I said it could be that you actually have enough estrogen, you just need to have the progesterone restored, and then your estrogen will work again. And I said, why don't we try that for, say, 3 months? And I encourage them to use it in a cyclic way, as if they were going to have periods, and to take 2 weeks off and see if a period comes, then go 2 weeks on the hormone, and use 15 or 20 milligrams a day in that time. And lo and behold, a lot of the estrogen deficiency symptoms go away. I would say it's as high as 75 or 80% of the time. The estrogen is there, it's just not working. The vaginal dryness goes away, the bad sleep problems go away, even some of the hot flushes go away. But then I say, if you've been on progesterone and you've given it a very good try, and you still have terrible hot flushes and you still can't sleep and so on, then you are one of the few people who actually needs a little estrogen. And if you're going to take some estrogen, make sure it's a real human estrogen that you're taking. A little estrone, a little estriol. I tell them I'm not a particular fan of estradiol, because that's the one that's more potent, most potent to the breast. But you can find ways of applying and getting into the body a little additional estrogen. I also tell them about herbs and foods that have phytoestrogens. You know, that the isoflavones, the wonderful things that are in beans and nuts and in the surrounding of the orange and the orange peel, it's even there, it's all over, that all these have been found to have a very nice, safe, minor estrogen effect. And sometimes that's all that people need, is to change their diet, or the essential fatty acid in the oil, in the right oils to get. A lot of people change their diets. The body wants to be well.
Yes.
That's the important thing to remember. The body is designed to get well. Yes. All we have to do is to find, how can we aid the body to get well.
All right, now the next question I get from my audience is, my doctor says natural hormones do not protect the heart, and Premarin does.
See, the idea of the estrogen protecting the heart was circumstantial evidence from the Harvard nurses study.
Right, I remember that one.
Remember that. They had these young, slim, non-cigarette smoking, but tennis-playing nurses who had been given estrogen, and they didn't have a heart attack. Whereas these obese, diabetic, cigarette-smoking, non-tennis-playing women with a history of cardiovascular disease and vascular disorders in the past were not given estrogen, and a few more of them had a heart attack later on. So I wrote to the authors originally, and I said, you weren't comparing equal groups. And they said, oh, well, we made the adjustments for that. And then I wrote back, I said, how did you know how to make the adjustments, since you have to assume so much? So there had never been an actual study, a good study, where they actually compared people put on Premarin and people put on placebo, and then followed for 5.5 years to see who got the heart attack. Well, that study is now completed. And it's in the New England Journal of Medicine, and it's in this list, and it shows that after 5.5 years, there is no difference.
Oh,
and
you have that right
that
in
is
there.
in here,
Good.
right. And then I mentioned the Framingham study. It's approaching 40 years now of following the people in Framingham, Massachusetts, and they have all the data on all these people, what medicines they're taking, what foods they're eating, and everything for 40 years, and they have looked at their data to see if taking estrogen prevented heart attacks, and it hasn't.
Well, this is even more important that they could hand this. See, we want you to write in, send a self-addressed stamped envelope. We'll just make copies, and we'll put it in the envelope for you. Take it to your doctor and educate him. The more, the merrier. The more people that know about this stuff. On
the other side, see, I'm not saying that it maybe does nothing, but it happens that after menopause, many women make enough estrogen to do whatever benefit it is. Taking more doesn't do more. But there have been now 3 good studies, 2 of them published, and one will be published shortly. In fact, it was published in March, showing that progesterone has benefits to the heart that estrogen does not have.
Good.
One is that it prevents the coronary arteries from going into spasm.
Good.
Whereas Provera caused them to go into unrelenting spasm. Isn't that amazing?
Ooh.
Progesterone keeps the coronary arteries open. This has been published now in 6 different journals. Then there are 2 other effects, and one has to do with the cholesterol buildup in the walls of the coronary arteries and the arteries around the body. Progesterone has 2 ways that it helps to prevent that. One is on the cells that become the foam cells that are trying to eat up the cholesterol by turning it into cholesterol esters and try to remove it. And the progesterone gets that out of there without the buildup occurring. And also cortisone, stress, increases the rate at which these foam cells build up cholesterol in the wall of the artery, and progesterone blocks it. And nothing else does that.
Praise God.
The good guys are coming through.
All right. Dr. Lee, thank you, bless you.
Well, it's an ongoing process.
It's an ongoing process.
Wasn't that great? Thank you so much for being with me today.